Hey, it's Dr. Stuart Rammell with Pinnacle Pain and Spine. Today I want to take a few minutes to talk about an advanced interventional neurostimulation option to treat focal neuropathic pain in the arms and the legs. And this pain often comes after having had a previous surgery on most commonly the groin, hip, knee, or ankle, or after a sometimes minor injury that develops into an exaggerated pain response in a process called complex regional pain syndrome, or previously called reflex sympathetic dystrophy or causalgia. Now, the dorsal root ganglion is a collection of cell bodies from sensory nerves that come from the periphery, or that come from the arms and the legs. When those sensations are felt by the arms and legs, the information is sent through peripheral nerves coming back into the spine, and they come back through the processing center where the cell bodies are, just on the outside of where they're coming back into the spinal segments. Each spinal segment between the neck and the low back has these dorsal root ganglia. Using neurostimulation, we can apply an electrical lead over the dorsal root ganglion and create an electrical current over that, which can modulate the way that inappropriate pain signals are being sent from the periphery and sensed at the level of the dorsal root ganglion. This is an interesting consideration because we can target where we are applying neurostimulation therapy for inappropriate neuropathic pain of the extremities. So in a model of the spine right here, we can see that each of the different vertebral segments here, there's peripheral nerves that come in from the arms and legs and have their collection of cell bodies, that dorsal root ganglion, and then they pass that processing information through the spinal cord up into the brain for central processing and for conscious perception of that pain. So, as an example of somebody who would be a good candidate to be considered for this therapy of dorsal root ganglion stimulation, let's use the example of a previous groin surgery or a hernia surgery. So even in a hernia surgery that is done properly to reduce a hernia back into inside the abdominal cavity where it belongs, there can be damage to some of the small nerve fibers, and the body can create an exaggerated pain response to that. So some people, after having had a previous groin surgery, will have a constant burning, throbbing pain in the groin that we call neuropathic pain. By applying electrical stimulation over the processing center of those cells from those damaged nerves in the groin, we can modulate the way those signals are sent and improve that pain without causing any sort of noticeable sensation to the patient. The way that dorsal root ganglion stimulation leads are placed are through, it's a minimally invasive procedure, through a live x-ray, initially using needles to access the spinal space, and then passing the electrical leads under image guidance right over to where the cell bodies of those dorsal root ganglia are. Now, similar to other neuromodulation techniques that I offer, like spinal cord stimulation, patients would undergo a temporary trial where the leads are placed through the skin and the leads are externalized to an external battery for a certain amount of time, generally between 3 and 7 days, to see if they get excellent relief. In patients who do very well and have a significant reduction in pain and improvement in function, then they would be a good candidate to move on with the permanent implantation procedure, which is also relatively minimally invasive, where the leads are just secured underneath the skin and then passed to a small pocket that's made in the low back or buttock, and then a small battery is placed in that pocket to power the therapy. So this is a very ingenious system that we have available to us. There have been several studies that have been done on dorsal root ganglion stimulation, even level 1 randomized controlled trials that have showed fantastic efficacy of this therapy for patients who have neuropathic pain in the extremities. So when thinking about a patient who would be a good candidate for this, I like to think about the rule that if you can place your hand over where you're feeling that focal, specific, burning, throbbing pain in a distinct focal area, then that would make them, in my mind, a good candidate to at least be considered for a trial for dorsal root ganglion stimulation. So the patients that I will think about this therapy for are people like my example of people who've had a previous groin surgery continue to have pain, previous hip surgery continue to have pain, previous knee surgery or ankle surgery who continue to have pain, or have had a small injury to some part of an extremity and they have an exaggerated response where they're feeling like a constant neuropathic type pain. This can be a potentially life-changing therapy for these folks, and it's something that I'm happy that I'm able to offer. So if this is something that you've experienced, these pain symptoms, come into my clinic and let's talk about it and see if you'd be a good candidate for moving forward with a trial and potential implantation. If this is something that we've already talked about and we've been kind of working towards this, then I'm hopeful that we can move forward and hopefully get you some excellent relief. So I'm grateful to offer this therapy, and as always, come in and let's have a discussion about this and see if this therapy is right for you.